We heard just that people are coming out from another seminar, but I think we will start because this is the final discussion or seminar for today. And we are very happy to welcome some distinguished guests. And first of all, from this side, Desiree Pethrus, I have to say, a former colleague to me from Swedish Parliament, but now the regional councillor of Region Stockholm. Then we have Anders Åkesson, who is the president of the Swedish Heart and Lung Association. And we also have Emanuele Degortes.
Very well.
From somewhere in the life science industry that we just heard about. VIFOR or CSL VIFOR. Yeah, that's the correct name. And of course, my colleague for today, Neil Johnson from the Global Heart Hub. And we will try to ask some questions to you with different perspectives. And we will start with some introduction from the three of you. And I think we'll start with Anders.
Okay, thank you. Great to be here. So thank you for inviting, and thank you for discussing a really hot topic in the Swedish healthcare. Maybe you can help me with the slides. Come on, please, Penilla. Okay, let's see if we find that. And now we are back to that, and now I'm here. No? So let's see if we can find. Yeah, great. Yeah, it's no problem. Thank you. Thank you to be here, and thank you for bringing this subject up of heart and diseases and heart failure. In Sweden, we have 2 million people who have a heart failure, and we are it's a great problem here in Sweden with the equality in the healthcare system. And we'll come back to that, and I think that in the panel debate, and how we can do that in a European context, also in a national context. I just want to focus on and what, yeah. Okay, that's having some help. That's really good, because if we can help each other, I think that will be contribute to everything, as you said here before, Neil and everyone. And we need to learn from each other. Now I learned how to do that. That's great. Yes, a short introduction to the Swedish Heart and Lung Association. We are a big patient organization, almost 35,000 members in 170 regional and local associations. And we also have 7 national member organizations, and one of those are Viking, right? Yeah, and that's great. And we also founded, we are the oldest patient organization here in Sweden, almost 80 years of experience. And that is also in a perspective I want to lift in this national and European context, because here in Sweden we have a lot of citizens that are occupying and are members of organizations. It can be in training, it could be in the patient organizations or something, culture and so on. And that is also need to be remembered also. As a patient organization, we offer adapted cardiac rehabilitation training and programs, and we also do a lot of public opinion, and that is also a part of that, of course, we are here. And as I told you before, we are, and now I put the finger down here. Let me see. Yeah, and nothing happens. That's great. I put the finger on. Oh! Great help again. Yes. And as I said, we have a new model for also cardiac rehabilitation, and the perspective that is really necessary here in Sweden, because we are quite good at maybe doing the acute phase, but we need to be better in the rehabilitation. And as I showed that film here, I was really impressed by the film from that showed both films, I would say, and also the film that the monitoring that we saw before, because I think that the self-care discussion is right on topic and right on the spot, because we need to involve the patient in a more better way and get the patients really to have knowledge about their own disease and sickness and so on, and their own heart failure. I think that you need to be a partnership between the healthcare and the politicians and the patients. I think that's really necessary, because if we find that triangle, and also the academy, and also the industry, I think we have gone further. I think we can take the next step. And because we need to do that, and we need to get down to sitting down by the table and discussing all the issues that we have according to the patient's pathways in the healthcare. And I think we have a good representative here from the political level, can also show that, and I hope that the debate we have, the panel debate, can also show that. We also provide free patient education for healthcare providers to use. So we need to involve and engage with the health providers in a better way, and we try to do that. It's not easy always, because we also know that the healthcare here in Sweden are really pressed at the moment. They have problem with competence, they have problem with lack of beds and so on, but we need to be there and also be a part of that. And we also need to understand the healthcare professionals' perspective in the careness and so on. I think I stop there for the moment, and I come back when the panel debate.
Thank you so much, Anders, for that introduction. And we will come back with some questions, as we said, but we will like to welcome Desiree. And you will speak in Swedish.
Yeah, I'm sorry. When I was invited, I didn't think that I was going to prepare in English, and you told me yesterday it's okay to do it in Swedish. So I'm sorry if there's someone here who don't understand. I don't think there is any interpretation, but maybe you can interpret afterwards a little bit, Penilla, because you're training your English more now. I am the regional chair or regional councilor for the Stockholm region. So. And we are now just had an election, as you know, so we don't know if I'm going to continue as that. But for the moment, I'm still responsible of healthcare development in the Stockholm region. Region Stockholm är med sina 2,4 miljoner invånare Sveriges största region. Regionen är också en av Sveriges största arbetsgivare med 45 000 medarbetare. Varav merparten då arbetar inom hälso- och sjukvården. Vi ansvarar ju då för länets hälso- och sjukvård och tandvård. Och det är ju både sjukvård, hälsofrämjande arbete, forskning, utbildning och utveckling. Av regionens budget, som är 119 miljarder kronor, så går drygt 70 till hälso- och sjukvård för vår region. En vanlig dag besöker 13 800 patienter en husläkarmottagning, och i snitt vänder sig 1325 personer till en akutmottagning. Det är alltså en stor vårdapparat med många patientmöten varje dag. Medicinska framsteg men också en åldrande befolkning innebär ju både möjligheter men också stora utmaningar. Idag på det här forumet nu så fokuserar vi ju på ett väldigt viktigt område, hjärt- och kärlsjukdomar. Vi vet att hjärt- och kärlsjukdomar idag är den vanligaste dödsorsaken i Sverige. Enligt Socialstyrelsen berodde 28% av samtliga dödsfall år 2020 på hjärt- och kärlsjukdom. Och det är ju då inte konstigt att det också klassas som en folksjukdom. Vad kan vi då göra för att förbättra läget? Och det positiva då är ju att många av de folksjukdomar som vi har kan förebyggas genom både samhälleliga och individfokuserade insatser. Vi som är här idag har ju olika roller. Som vårdutvecklingsregionråd så har jag ett ansvar för kunskapsstyrningen i vården. Kunskapsstyrning handlar ju om att utveckla, sprida och använda bästa möjliga kunskap inom hälso- och sjukvården. Och målet är att bästa kunskap ska finnas tillgänglig och användas i varje patientmöte varje dag. Man kan kort säga också att målet är att få en mer jämlik vård. Det här var ju ett beslut som togs på nationell nivå vid, jag tror att det var 2018, och nu har vi då satt igång under den här mandatperioden med att försöka hitta vilka parametrar, hur vi ska bryta ner de nationella regionala programområdena till de nationella till regionala programområden, hur vi ska jobba i vår region för att förbättra vården inom hjärt- och kärlsjukdomar. Den medicinska utvecklingen kommer vi att behöva fortsätta att satsa på. Region Stockholm har varit framgångsrik i behandling av akut hjärtinfarkt, där flera av sjukhusen i nationella jämförelser visat på högsta kvalitet. Och det har möjliggjorts genom att bland annat 3 sjukhus har möjlighet till akut kranskärlsintervention dygnet runt, 7 dagar i veckan, och är strategiskt placerade i regioner för att minimera tiden från symptom till intervention. En god samverkan mellan vårdgivarna med gemensamma riktlinjer som är baserade då på internationella och nationella riktlinjer samt en kontinuerlig uppföljning av kvalitet och utfall har bidragit till den här framgången. Under 2012 till 2017 så kraftsamlade regionen kring ett forskningsprojekt som heter 4D. Och det är för 4 diagnoser: hjärtsvikt, bröstcancer, artrit och diabetes 2 i syfte att förbättra vården vid hjärtsvikt. Och det är ju just att se hur hjärtsjukdomen också finns i ett större sammanhang med andra sjukdomar. Man ökade riktade resurser till hjärtsviktsmottagningar under 5 år. Man tog också fram ett vårdprogram. Och 4D-projektet visade på så goda resultat med minskade sjukhusinläggningar, och satsningen har också tagit upp som förebild i nationella kunskapsstyrningen för införande av personcentrerat vårdförlopp för hjärtsvikt i Sverige. Vi i Region Stockholm är glada och stolta över de fina framsteg som vi har gjort, men det finns ju självklart fortsatt förbättringsområden. Till exempel så finns det tydliga geografiska skillnader inom regionen när det gäller kardiovaskulär hälsa, och här måste vi bli bättre på att nå ut i hela länet. Både i Stockholm och i andra regioner måste vi satsa mer på det förebyggande arbetet, och där det finns stora hälsovinster. Vi behöver satsa både mer på vården men också på forskningen för att ta fram metoder som på ett kostnadseffektivt sätt kan upptäcka dem med hög risk för hjärt- och kärlsjukdom redan innan de blir sjuka. Och det är någonting som jag kommer att återkomma lite grann kring, bland annat familjär hyperkolesterolemi-projektet som vi har. Tack.
Thank you. I think we just have a short presentation of Region Stockholm. We could say that you have 45,000 employees in the region here. There is a budget of 70 billion Swedish crowns for healthcare, and the Swedish healthcare system is divided in 21 regions, and of course the Stockholm region is the biggest and have also the most specialist care, of course, here in this region. So people are coming from other regions to be treated and have some specialized treatments. And Desiree is actually responsible for the development also within healthcare, to reach out with new knowledge to the employees and how to handle patients and so on. So it's, I think you do have one of the most interesting political jobs here in the region. Yeah. Emanuele, And you, coming from a different perspective, as you are representing a life science company. So tell us a bit about CSL VIFOR, please.
So I can tell you a bit about the company, but I think more interesting, I can tell you a little bit about the position of our company in terms of how we see treatment for. Here we're talking a lot about cardiovascular disease. Our main interest is primarily in heart failure. So I'll focus a little bit more on that. CSL VIFOR is a company that has a strong heritage in iron deficiency. And iron deficiency has been touched upon a number of times. But really building on this heritage, we've been focusing more and more in areas where iron deficiency is particularly prominent. And so kidney disease is one, and heart failure is another. And I think this is one of the reasons why we're here. Another quick element that I want to say is that as a company, one thing which we try to do is really to work in very close collaboration with a lot of patient groups. And so it was fantastic to actually see here today a lot of the groups that we collaborate with, be it the Global Heart Hub, be it AVEC, be it the Heart Failure Policy Network, even Heart Life in Canada. And we are really trying to do a job of listening to the patient perspective and shaping our strategy as a result of it. And so when we think about cardiovascular disease and the future of prevention, treatment, and also follow-up, our starting point is, what does the patient community think about those things? And essentially here, I'm going to be quoting some of their own work, but the couple of trends that we see very clearly, in particular around the treatment, where we have a situation where we do not yet have cures for a lot of cardiovascular diseases. And so most of the treatments are built around managing the condition. And so the first thing is focus on quality of life. So I think that the very important trend in cardiovascular disease, where cures are not yet there, is going to be how do we work on those modifiable factors to maximize the quality of life of people that have to live with a chronic condition. And this is an area which is particularly important because quality of life is not always given the importance that it should in comparison to other areas and other endpoints such as mortality and morbidity. And I think what we're trying to do is to almost flip that around, because in a survey that we have run with over 600 patients across Europe, you clearly see the quality of life is just as important as mortality and prolonging life. So clearly it needs to be put on an equal footing. And so how do we persuade regulators of the importance of including endpoints based on quality of life? How do we persuade payers in particular to value also products and treatments on quality of life? So quality of life is the first point. The second thing, which is a topic that the Heart Failure Policy Network has actually done a lot of work, is obviously the multidisciplinary care. So take a heart failure patient, how do we move away from a treatment focused on, let's say in inverted commas, a broken heart, to a treatment which looks at the patient in a more holistic way? We were talking about iron deficiency, and iron deficiency affects around 50% of heart failure patients and can have a big impact on their quality of life. It is correlated to fatigue as one of them. How come is it not screened even more regularly across Europe, across the world? So those type of intervention which really focus on looking at the patient more holistically, I think will become more and more important in the future.
Thank you so much, Emanuele. And I think I leave the floor to you, Neil.
Thank you. A couple of questions, if I can, maybe to you, Desiree. You work in the health system here, and I obviously I'm not familiar with it. But to what extent is the patient voice engaged in the development of the health service? Is there a process for this, or?
Yeah. Actually, there is a process both with, because what I was talking about is like evidence or knowledge-based programs for different diseases, within the region, and it comes from national, of course, like directions for how we should work with like different heart disease. And then the regional group of doctors and professionals, they involve patients. But also if we work together with our staff, what is the administrative staff who are doing a lot of job, they also engage patients. And we have also on the political level, we also engage patients. So we have different levels of engaging patients, but if I ask the organizations, I think they think it's not too much. But there are in all different levels, there are like a dialogue, yes.
Just picking up on Emanuele's point about quality of life, I mean, that's, and particularly in heart failure, you speak to people who live with heart failure, they will prioritize quality of life very high up there in terms of you know, what they want from their treatment. And I think where there's a mismatch is that the payers, for example, as you rightly pointed out, are you know, making their judgments against the hard endpoints that have been traditionally applied. But if the voice of the patient was stronger, perhaps there would be greater value placed on quality of life. And maybe we need to make sure that at a national level there are those structures to really understand what patients want. And I know that in some countries there are moves to allow this. They're creating structures where health authorities can take patient insights. So I'm just curious to know what the situation is in this part of the world.
Maybe it's better you answer.
Maybe shall I answer that?
Yeah.
It's a question for me. Okay. I would say, as Penilla said, we have quite a regional healthcare divided here. We have a national regulation on the healthcare in the healthcare area, but I would say that the regions are quite in a high level. I would say they can do as they like. Not so much now than before. I would say now we're trying to follow it up in a better way in every level. I would say that we try to follow it up, and on a national level and regional level and so on. There are different layers that follow it up. The authorities, of course, and also the region themselves, and also the region's member organization, SALA. But still, I would say I would say that region Stockholm is good to have put the discussions with the patient organization, the patient representatives in all layers, I would say, but. According to that and how it's divided in the regional level, I would say that we have regions that it doesn't focus so much on it. So, and I would also say that the patient organizations need to be on the table, in the rooms, in the right, in the beginning of the work, and not when it's really done, because then it's too late. And you don't have this opportunity to follow up and fill up the gaps. I would say that is person-centered care. So we still have gaps to follow up, and I would say, and of course, if you try to put the EU level on that, of course we can help each other. And I would say, according to the cancer discussion we have had in Europe for a decade now, I think that I would like to see that we have the same way here on the heart disease, and so we can put goals for Europe on this. I think that would be contribute, of course, here to Sweden, but also in a European context, and also in a global context. I think it would be good. And you also need to think of the European life science discussion in that, because I think that would, I think that will be a benefit for everyone.
So Desiree, can I ask you, from the point of view of the national government, is there a formal cardiovascular health plan for Sweden, or strategy, or what determines the direction of travel?
I don't think there is it's more like this, like I talked about, there's a new system since 2018, where we have like national programs that we develop all the time for how to take care of different diseases, and then they should be implemented in the regions. So that's what I work with in my NEMD, my committee. That's the thing. Otherwise, I don't think it's special. Nothing special from the government that they're doing, like national programs, like advocacy or so. But it's national centered like implementation that should be like in the regions.
Yeah.
For the best way we know for the moment how to deal with this care. But what I have learned since I started with this work is like that so many diseases are connecting to each other, and that has been something new for me as a politician to understand how they connect. So like on Friday when I'm going to see the diabetic organizations, and then I know that they usually bring that forward. For example, that they are very much combined to like cardiac diseases.
Yeah, it's a chronic diseases that together.
But it's interesting, as something was discussed earlier on today, and I'm unapologetic in saying this. I think that as a society across Europe, across the world, we have just become unacceptably complacent about cardiovascular disease. In my own country, again, so it's not throwing stones at another country. And in my own country, we don't have a national cardiovascular strategy. We don't have a national cardiovascular plan. In the European landscape right now, you have EACH, the European Coalition on Cardiovascular Health. And it's the first attempt to try and encourage at a European level an action plan on cardiovascular disease like you have for cancer. But when such a large proportion of the burden of cardiovascular disease is preventable, and we know pretty much the causes, and we pretty much have the treatments and the technologies to at least mitigate the damage, it's almost unfathomable that at a political level it's not a priority. I struggle to understand what is it about us that we're not taking it seriously.
Yeah, as for us coming from the biggest region in Sweden, I think we have a big responsibility to go forward with like development and research and how to be better in how to make the best progress for the patients. And so it could also be implemented in the national level. As I told you here, there was we had a program between 2012, I think it was, and 16, 17. And that is also something that was like brought into the national segment. So I think we have to realize, I mean, my party works for that we should have not 21 regions, we should have one national healthcare system actually, and that is organized, because today it's very unequal with a lot of things. Like for screening example for cancer, in some regions don't have like half what we have in Stockholm region, so, and that's unequal. So we need to have more focus on how can we reach out. I think in Stockholm maybe we have very much research, we have a lot of specialists, but if you go up to the north of Sweden, they don't have all these specialists. Yeah. It's not so easy for them to have the development and research there.
So Andres, as a representative of the biggest patient organization, do you think that there's a role here for the patient voice, and is this something that needs to be elevated at a political level?
Yeah, of course, and I would say that according to what you said about cancer, I think that would be really good to have that focus also in a European context, to have a long-term action plan for that. And also in that plan also have the prevention care and how you can avoid heart diseases and so on, according to what you eat and how you do and how you train and so on. I think that's really should be good. And also in Sweden have a special possibility to also to use this quite good registration we have here, and also use the health data possibilities. It's not we need to get rid of the regulations on that area, and we need to get better legislation and possibilities to the patients to be a part of the healthcare system, also with their own data and so on, I would say. To build a partnership, I would say. That's and I think the patients want to be that. I think the patients really want to be providers also to their own and understand their own healthcare and their own sickness, but they also want to provide to the research and the possibility to have new pharma and so on for the next generation. So
sometimes when there's a discussion about patients, there's the sense that there's something external to all of us. You know, they're these poor people who are inflicted with a health condition. The reality is we're all going to be patients at some point.
Yeah, of course.
And so really, I think we should be talking about this is a citizen issue. It's a rights issue, and we should be really activating that voice.
I think we discussed that when I met you the other day here, Neil, about that this is a long-term disease, and when you have a heart failure and so on, that also when you have it when you go to elderly care and you have you live in an elderly home and so on, and we know that according to the COVID crisis here in Sweden, that a lot of elderly people really the municipality care, the health care in the municipality failed, and also in the regional health care failed to take care of the elderly people, and that was a lot of persons with chronic diseases who suffered that, I would say, really suffered.
I would like to ask you about policy work then, Emanuele, because your company, I have experienced that since you are involved in all these networking and help patient organizations and I mean policymakers to really create something new and the progress within policy. What's in it for you?
Well, what's in it for us? I think that what we all have an interest in is improving standards of care. And I think when I was talking before, like a big policy push that we're trying to make is around, shifting the perception and giving quality of life more importance. What's in it for us, to be fully honest and perfectly cynical, is that we have some treatments that can improve quality of life of patients. We have that in heart failure, we have that also in kidney disease. And we have noticed that in interactions with payers, with policymakers, with healthcare systems, sometimes treatments that can have a drastic impact on a patient quality of life, they're sort of seen, they're not prioritized, they're not put first line. So I think that by giving more focus to that area, which is a great focus of ours in the policy work that we do, we're hoping to improve standards of care, and we have a sort of secondary benefit as a result. The other thing I wanted to touch upon, because it was really interesting, the discussion we're having about the role of patients and patient voice in things like HTA discussions. It looks, as someone who's a little bit from outside, let's say, a lot of the cardiovascular disease groups, they do a lot of focus on prevention. And as a result of that, I think that they focus a little bit less on, let's say, more of the access topics. While for other conditions, take rare diseases, genetic conditions where you cannot do much prevention, the entire focus is there's a lot more on the access and things, and therefore they have more expertise. So I think that any initiatives also to get more training for the patient community in the cardiovascular space on what is HTA, what are opportunities to provide input, I think will be so important to actually elevating their voice.
I think it's so important that we really do have support from life science companies to create change, because even though I said in the in the former seminar that sometimes it doesn't depend on financial resources, but of course it helps patient organizations and patient advocates and to create sometimes reports and meetings and so on to really make more to create more attention also to the different issues. I think the combination at this stage right now is, from patient association, policymaker, life science company, a really true patient network. I think that's really a combination that should be unbeatable, really. Because I do think it's so important to meet each other at the same arena. And that's really what, of course, I think we both are striving for. We have really run out of time, I think, soon at least. But some last questions, Neil.
Maybe two comments. One is I think what's maybe unique in the cardiovascular world is the coexistence of comorbidities. And one of the things you hear very often from a patient perspective is that their treatment is very much dealt with in silos. And I'm wondering, maybe this is a question for you, Desiree, does that is that also something that happens at a policy level, that perhaps the approach to cardiovascular disease may be siloed and it isn't encompassing the wider picture, because there's such a linkage between kidney disease, diabetes, obesity, that maybe a more holistic policy approach is required?
Actually, now the program officers for the different programs are now combining to work with heart failure, and there are 6 different regional programs that are going to work together, and it's with primary care, living conditions, heart disease, endocrine, metabolic, kidneys, and nerve systems. All these are going to work together now. To like, how can we work together for a better situation and dealing with heart failure. So there are like that initiatives now in our region.
And just finally, in relation to your point, Emanuele, about the role of patient organizations in processes like HTA, my sense is that in the cardiovascular world, at least, the vast majority of the patient organizations that evolved around care, support, peer education, and so forth. And it's almost as if they're not yet aware of the role that they can play in areas like HTA, policy advocacy, and so forth. So that's certainly something within the global hub that we're trying to highlight, that there is a huge role for patient organizations here. And at the end of the day, anything in the political world is about numbers and voices and people power. So you take the proportion of any population living with cardiovascular disease, they represent a very strong number,
So, if you should just say a few words, and now I know that you would like to say more, longer, but if you have to say just a few words about cardiovascular diseases and how to really, what is the most important thing within the cardiovascular diseases area for you from your perspective and your area of working? Emanuele.
3 things. Prevention, keep on focusing on innovation, and multidisciplinary care with a particular focus on quality of life.
Okay, thank you. Do we have some more votes?
I think that was really the patient collaboration and engagement with the patient organizations. I would say it's really really necessary, and of course also in the in the discussion now we have here in Sweden, how we're transforming in the Swedish healthcare system to knowledge-based, more knowledge-based treatment and so on, and also the discussion how we transform the primary care. I would say it's necessary to have in focus the persons that have chronic diseases. So, but I would say engagement and patient collaboration is on really need to be focused in the future.
Thank you. And Desiree?
Thank you. Yeah, I think we should continue now with the work that we have started in the region, that we evaluate every year what has happened in this program for cardiac diseases, and we evaluate and how can we improve it. And in that case, we will also, of course, involve the patients' organizations. But I was also thinking about what Neil was bringing forward, and I was thinking about on the cancer treatments. I think the government, 2009, took forward starting regional cancer centers. And that was something that has been very, very successful, I think. So, of course, I think I bring with me also that could be for heart diseases, because it's such a big problem for the Swedish, in the healthcare. There are so many people are suffering from heart diseases. So thank you.
Thank you. And I will end this by also asking you, Neil, because you are working with so many areas within cardiovascular diseases. And since we are calling this day for CVD FORUM, what do you think, if we think of all these kind of conditions, what do you think is the most, common thing that also could be done from a policy perspective, in your opinion?
Well, I think that we actually need to prioritize cardiovascular health because it's a no-brainer. We can improve the cardiovascular health of our population. We know how to do it. We just need the political will and strategies to do it. And particularly in the context of the Global Heart Hub, many of the patient organizations will say, nothing for us without us. And the whole idea of the Global Heart Hub is to try and strengthen the patient voice. And again, maybe we should be thinking about this as the citizen voice, because at the end of the day, healthcare is a right, and we have made tremendous advances. And so we should have the right to the best possible treatment at the right time for the right patient. And that's what we should all be striving for as a society, I think.
And as you said before, and as we always say in Focus Patient, that haven't you been a patient before, you will likely be sometime. So it's very good to have all the knowledge you can get to really be a patient voice, not only for yourself, but also for others. So thank you all for joining us at stage here, and all for coming. And I think that my colleague is hiding somewhere around the corner. Mattias?
So, see if I get the sound on my mic. All right. So, thank you for the last session of the day, and thank you everybody for coming here to the venue today from, I don't know how many countries. I think it's today it's.
We were I think we were 18.
Wow.
Only 18 countries. Next year, 25, 30. So my name is Mattias Hellström. I'm the CEO of Citizens Affairs, and I'm a co-founder of FOKUS Patient. And I hope you enjoyed all the panels and the speakers today. I've heard a lot of discussions out in the hallways, and it gladdens me to hear people speak in Swedish and in English and all other languages I heard today, and network between countries and network between networks and organizations and companies and a special thank you for, I'm going to come to Neil in a bit, but for our other partners and exhibitors making this day possible. Without you, we couldn't do this economically. So I'm glad that we have a broad support from life science and from other organizations. And a special thank you to Global Heart Hub coming here today, Neil Johnson and his colleague with a delegation. It makes us glad to be able to have international conferences. It's not just a conference; it's an international conference. And so I'm glad you helped us, and I hope you enjoy your stay here in Stockholm, Sweden, and networking with all these wonderful people we have here today.
And don't forget the networking event this evening at 7 o'clock. So keep on networking, we could say.
And if I can have the last word and say that it's been an absolute privilege for us as a new emerging organization to have had this opportunity to engage with Penilla and yourself. It was a very ambitious plan. It is a very ambitious undertaking to put together a 3-day program, international, with obviously great uncertainty post-COVID and so forth. I think you've done incredibly well. The quality of presentation, I think everyone will agree, has been spectacularly good. And that the conversations, even at the coffee breaks and lunch and evening, have been very rich. There's been certainly, from me, a great networking opportunity, and I know that the affiliates that we currently have here from Global Hub have really gained from this. So well done to you and all your team. It's a fantastic organization.
Yeah. Thank you, and a special thank you to my colleague Penilla, who's made the biggest of the efforts to make this happen. I'm just a...
Here.
In Swedish we will say I'm just a parentes i tillvaron jämfört med Penilla, so I'm very glad you are making this happen. So thank you. Thank you.